Hi, my name is Darcy, and this is my condition presentation on neurocognitive disorders, or NCD, due to traumatic brain injury. Traumatic brain injury is also called TBI. And if you look in the DSM-5 under neurocognitive disorders, you will find quite a list of different diagnoses. This presentation will focus on traumatic brain injury, and also major and mild neurocognitive disorders, because the criteria A for traumatic brain injury is major and mild neurocognitive disorders. This is the full criteria for traumatic brain injury, and like I said, the criteria A would be met for major and mild neurocognitive disorder, so we will look at that first. The criteria for major neurocognitive disorder is A, evidence of significant cognitive decline from a previous level of performance in one or more cognitive domains, such as cognitive attention, executive function, learning and memory, language, perceptual, motor, or social cognition, based on 1, concern of the individual, a knowledgeable informant, or the clinician that there has been a significant decline in cognitive function, and 2, substantial impairment in cognitive performance, preferably documented by standardized neuropsychological testing, or in its absence, another quantified clinical assessment. Also, criteria B for neurocognitive disorder is the cognitive deficits interfere with independence and everyday activities, at minimum requiring assistance with complex instrumental activities of daily living, such as paying bills or managing medications. C, the cognitive deficits do not occur exclusively in the context of delirium. And D, the cognitive deficits are not better explained by another mental disorder, such as depression or schizophrenia. So after we meet criteria A, we move on to criteria B for traumatic brain injury. And criteria B says that there is evidence of traumatic brain injury, that is, an impact to the head or other mechanisms of rapid movement or displacement of the brain within the skull, with one or more of the following: 1, loss of consciousness; 2, post-traumatic amnesia; 3, disorientation and confusion; or 4, neurological signs such as neuroimaging demonstrating injury, a new onset of seizures, a marked worsening of pre-existing seizure disorder, visual field cuts, anosmia, and hemiparesis. And finally, C for traumatic brain injury would be the neurocognitive disorder presents immediately after the occurrence of the traumatic brain injury, or immediately after recovery of consciousness, and persists past the acute post-injury period. With coding for a major or mild neurocognitive disorder due to traumatic brain injury, you would mark it with or without behavioral disturbance. So the major neurocognitive disorder due to traumatic brain injury with behavioral disturbance would be marked with a 0, and with behavioral disturbance would be marked with a 1, and without would be marked with a 0. So for the mild neurocognitive disorder due to traumatic brain injury is basically referred to as a concussion, and there's also coding for the mild section 2, but it's basically the same, except it just everything is minimal compared to the major neurocognitive brain injury. So I'm mostly going to just cover the major traumatic brain injury, because the mild is exactly the same except for small, less injury. The symptoms for mild traumatic brain injury would include headache, confusion, lightheadedness, dizziness, blurred vision or tired eyes, ringing in the ears, bad taste in the mouth, fatigue or lethargy, a change in sleep patterns, behavioral mood changes, and trouble with memory, concentration, attention, and thinking. For moderate and severe TBI or critical and serious. They could be, they're marked with coma or near death. Severe brain injury is defined as a brain injury resulting in loss of consciousness of greater than 6 hours. In moderate or severe TBI, the injury cannot be reversed, but or the damage to the brain cannot be reversed, but immediate medical attention can prevent further damage. Francis covers neurocognitive disorders, but mostly has included traumatic brain injury in with talking about dementia, and he cautions against using the mild neurocognitive disorder diagnosis, because he says that you're using it when you are pre-diagnosing for dementia, when you think the client is going to start having dementia or Alzheimer's. But like I said, in the Francis book, he grouped TBI in with dementia, probably because there were so many. TBI looks different for different people, and the reason I chose this condition is because I've had 2 personal experiences with people with TBI, and the first one was a client who was 5 years old. It was a little boy who was charming, adorable, and he had TBI because of meningitis. He had behavioral issues, a short attention span. He enjoyed doing things that created attention or shock value from others. He would request something, and as soon as he got it, he would do the opposite. And he had other behaviors such as physical and verbal aggression when he was not allowed to do what he wanted. The second person that I know that had TBI is my brother-in-law, who fell last summer. On July 27th, he fell from his tank truck at work. He was putting gas on top and he fell. He doesn't remember that fall, but he at first had delirium, which is also described under neurocognitive disorders in a DSM-5. My brother-in-law may look and act normal to you, but he still feels very different. Even some of my relatives will say he is normal now, but dealing with traumatic brain injury for many may not feel like themselves, or may not feel like they fit in. I bring up these 2 experiences because I found that TBI looks very different in people. Traumatic brain injury is sometimes referred to as an acquired brain injury, and there are 2 types of brain injuries: traumatic brain injury and non-traumatic brain injury, even though in their diagnosis it might just be called TBI. Examples of traumatic brain injury would be assault, car accidents, sports injuries, shaken baby syndrome, gunshot wounds, domestic violence, child abuse. And non-traumatic would be infectious diseases such as meningitis, seizures, electric shock, tumors, neurotoxic poisoning such as carbon monoxide or lead exposure, drug overdose, or lack of oxygen due to situations like near drowning. So basically, traumatic brain injury the damage from the brain cannot be reversed, but immediate attention can help stop it where it's at. And mild brain injury is a concussion. Moderate and severe are near-death experiences, require a CT scan and follow-up, meaning after the person is being discharged from the hospital or getting near to being discharged. It would require physical therapy, occupational therapy, speech therapy, physical medicine, psychiatry, and social support. In the United States every year, 1.7 million people acquire TBIs. After 5 years after getting a TBI, the 22% of people died, 30% became worse, 22% stayed home, and 26% improved. 55% had a job but never returned to work, and a person with a TBI, a moderate to severe TBI, is 55% more likely to get seizures. And after surviving the TBI, a person's life expectancy is 9 years shorter. Thank you for watching, and this is a link to my video. Have a great day.